the global numbers broken down, 183 million are male, 145 million are female, and 32 million are children. You might like to think, why are more men than women affected with hearing loss in the world? That can be, we can discuss that on one of the discussion forums, but think about what reasons you can think of for that. And then if we look at the different levels of severity, you'll see that the number of people with mild hearing loss is by far the larger. And then we get to the numbers with moderate hearing loss and the numbers with severe hearing loss, until the smallest group is the numbers with profound hearing loss. Now, if we look at how these numbers are distributed in different parts of the world, these are the regional groups, again according to the World Bank. And you can see immediately that the area of the world with the largest number of people is South Asia, and that includes India, Bangladesh, Sri Lanka, Pakistan, and so on. So that is the South Asian group. The next largest is the East Asian group, which includes China and countries in that part of the world. And then the other parts of the world, for example, sub-Saharan Africa, is quite similar in terms of numbers to the high-income countries. But if you these are just absolute numbers. If we look at the prevalence, that's the percentage in the population that have hearing loss. This gives a better idea of the amount of hearing loss as a proportion of the population. The picture is somewhat similar. Certainly in South Asia, the dark blue columns are the over 65-year-olds, the green columns 15 to 64 and red 0 to 14. But still, we've got the highest prevalence. So in South Asia, they have not only the largest number of people, which of course depends to some extent on the total numbers in the population, but they also have the highest prevalence, certainly in the elderly. But the next highest prevalence this time is in sub-Saharan Africa, although you remember the total numbers were less because the total population of sub-Saharan Africa is less than some other regions. The prevalence is very high. And then also Asia-Pacific region is very high. East Asia with China is a somewhat lower prevalence, but then high-income countries have the lowest prevalence because they have the best health services, as you might expect. And this map shows where some of the surveys have been done that I've been involved with. These are WHO surveys using a particular WHO protocol, which is a standard protocol, so you can compare the results. And these numbers in red are the prevalence of disabling hearing loss in these particular surveys. And you'll see in most of the surveys there are similar frequencies. So in Brazil it was 6.8%, in Vietnam it was 7.8%, or in the north 4.7%, in the south. In China, quite similar. Oman was somewhat lower because I think they had better health services. But somewhat similar throughout the world. One thing you might notice is there are not actually very many surveys have been done. We'll come back to that later on. There's a lot of problems collecting hearing loss data. For example, you need to have soundproof testing sites because ambient noise can falsify the data or make hearing loss seem worse than it is. You had increased numbers of false positives, particularly for mild hearing loss. So that's one problem you need to test in a quiet place. Countries use different categories sometimes. You need to have standard categories. And most studies find it difficult to test the cause of hearing loss. You can more easily measure the total numbers with hearing loss, but it's finding the cause is difficult. And there's often surveys have been of poor quality epidemiologically. There's also a great lack of funds in this field So that's another reason why we haven't done very many surveys. These are some pictures from a survey that was done in Madagascar that I was involved with. I want to use these because there's one phrase that we have when we're doing a survey: no survey without service. So anybody who comes to a survey should also have the opportunity to get some treatment if they need it. And in a very poor country like Madagascar, then the people have probably never had any opportunity to get any form of treatment for their hearing problem. So this girl here, she has a discharging ear. She's got a burst eardrum, and there's a chronic discharge coming from her middle ear. So the member of the health survey team, who's also an ENT specialist, is mopping the pus from her ear, and then we'll put some antibiotic drops into the ear afterwards and give the drops to her mother to continue doing that. This old man came complaining that he had a hearing problem, and when they looked inside his ear, they found that he had impacted wax in both ears. And when that was something that could be dealt with by the team, they removed the wax, and he was miraculously, his hearing improved. So he went to the villages around and proclaimed how wonderful this team was. So the next day we had a huge number of people come along all to get their hearing tested. So, and these are two other pictures showing a little girl under the age of 4. She's actually being tested using a portable battery-operated audiometer, using noise-excluding headsets. And when she hears the sound, she puts a finger up. For very young children, we used a different approach called otoacoustic emissions. And this machine is testing her hearing directly with a probe into the outer ear canal. So she doesn't need to do anything. That can test it automatically. This shows the changes in the global estimates according to the WHO since 1985. So you'll see that the total number of people with disabling hearing loss in the world has gone up from, in 1985, 42 million, tripled by 10 years later in 1995, 120 million. By 2005, the estimate was 278 million, until we get to today's or the 2012 figure, which is 360 million. So there's a continuous increase over this period. And the majority, that's the yellow column, are in the low and middle income countries throughout this time. But that difference has actually got worse. You'll see it's actually come down a bit in the high income countries. So I'd like you to think as to what do you think is the reason why this number of people with hearing loss is increasing in the world, particularly in developing countries? What are the reasons for that? And why is there more hearing loss in developing countries than there is in the developed world? That's proportionately. There's more in terms of numbers, but also more by prevalence, by proportion. How is this data going to help us? Well, it's going to raise awareness. When we collect data, it will raise awareness about the size of the problem. It'll also help planners to determine the priorities. What subject should we particularly focus on, and where should we focus on it? And then to select the different strategies for prevention and predict the needs in the program, and also help this burden of disease measurement. I'm going to talk about that in the next session. Oh, that's the title paper of another study that's been done looking at 42 different surveys of hearing loss. This was a more recent study by an epidemiology group, some of whom work at WHO. And they've shown very clearly in these graphs how hearing loss, as the intensity increases, then the prevalence decreases. So the proportion in the population decreases as intensity increases, but as you get older, then the more people in the population have hearing loss. So that's everybody's experience. Elderly people, there's more elderly people in the population who have a hearing loss than younger people have a hearing loss in the population. And these charts show this according to the different regions. So this is actually comparing the WHO figures, which I've shown in preceding slides, that's the red pluses, compared with this new set of data that's been looked at. And you'll see they've actually found quite higher prevalences in both men and both women for this data than in the WHO original surveys. But in children, it's the other way around. The WHO prevalences were higher than in this new analysis of surveys. So here's another question for you to consider. Why do you think the children in the WHO 2012 analysis, that's the red pluses, consistently have higher prevalences than this Stevens data, that's the blue pluses, but in the adults in the previous slides, it's the other way around. So think about what reasons you can think of for that. And then when we look at this is just a table of the same data, so it's just showing that the prevalences from this Stevens data, this new data, is higher. There's higher prevalences in adult males, females, lower in children, but overall the total figure is much greater. The total number is over 500 million compared to 360 million, even though they're actually looking at the same surveys. They're pretty much the same surveys were looked at in this study as in this study. So why do you think the Stevens figures, that's the final column, are so much higher than the WHO column? I want you to try and think about why that is. Some of the clues for the reasons for that are on that slide. And some of the key points or key recommendations that came out of this Stevens paper were that the estimates of hearing loss are so uncertain because so few population-based surveys have been done measuring hearing loss, and that we need repeated cross-sectional population-based surveys urgently to determine the trends, particularly in those regions in the developing world with the highest prevalences. So that's where we need to focus. Now, this last slide just highlights some of our research priorities in this field that we recently got from a strategy development meeting. So we feel that there's a need to establish uniform data collection standards and tools for rapid assessment of hearing loss. There's also data is needed on prevalence and etiology from most low and middle income countries. And then we can use this data to do other studies, such as impact studies. These are things like the cost effectiveness of screening and early intervention, and then the impact of hearing impairment on poverty and quality of life. And then finally, we need to do more evaluation of actual programs. These are aspects of program. Thanks for listening.